Greg has a heart. You know what? I love that. I love that you answered that because some people think that doctors don't care. They think that, they look at the
Hmm.
paperwork, they look at the numbers, they
Hmm.
follow
And
the
just like that, baby, I'm in the building.
traditional
How
style.
you doing, baby?
Greg don't
Happy
care.
Thanksgiving.
He's
It's your
gonna go
girl,
play
baby.
golf or
The
whatever. He doesn't care. He just
invigorating
want to put me on
Duchess, okay?
medicine. He got a
Y'all
job with a
already know you gotta
pharmaceutical
take care of your
company,
health, baby.
and he
Help
doesn't
this
care.
world. What you
So that's
doing?
another
What you
reason why I
doing?
wanted to have Greg
If
on
you're
here
not
because
going to see
Greg,
your
one of the first
PCP
things when I met
at
you,
least
I
once
remember
a
you
year,
say, everybody,
what
he's a doctor.
exactly are
And
you
he
doing?
said, I'm Greg.
If you don't
And
even
that
have a
always stuck
PCP,
with me. So when I was like,
what
Greg, tell
exactly
him
are you
Greg,
doing?
and it'd be
Like
probably 10
serious.
people in the room, they'd be
But
doc,
okay,
doc,
we got
doc.
cousin Greg
So when he
here,
said that to me,
Doctor
that always
Gregory
clarified that he
Honeycutt,
sees
my
Dr. Greg
cousin.
Newman as I
Y'all
see
know I
him
love
or
Greg.
anybody else.
I say, Greg,
So
come
with
down here
that
and talk
being
to the
said, and I
people about
appreciate
health
that about
care
you, Greg.
and the
You
importance
you
of
realize when you do
prevention
a
and seeing
job
your
like
PCP
this
and getting
long
your
enough
diagnosis.
that you're
Y'all
not
know
in
Greg is
control.
a surgeon, right?
I
Greg
truly
is a
believe God's
real
in
doctor,
control.
okay?
I think
Greg could cut
that
that cancer
there are
right up
some
out of you,
times in my
honey.
career
But
when,
Greg came to talk to
hopefully
us
God has
about
had a chance
healthcare
to work through
prevention, and
me.
we are so grateful.
Um,
So let's just
Got
listen
my
in
but
to
card.
what Cousin Greg has
is
to
it
say and how he
is it
educated us. And
really
he talked a
sad,
little bit about
when,
how he got
there are
close with a
times when there
patient
are
that
patients
passed
that I
away.
just cannot
This
help? And the
interview was
answer is
very
yes.
informative, and I loved it.
And that
It's
just tells me
very
that too is part of God's plan.
educational, and it's
That is
up
not what
there in
God
my
had in
top
mind for
five,
me.
definitely.
I still
But
view
Greg
it
is just my
as,
guy, so
perhaps I
that's just
failed,
me showing favoritism to
sometimes.
my cousin
But,
Greg.
as long
But I
as I
surely
have
hope that you
done
guys like
everything that I
this
can to take care of
interview.
patients, and
Go
that's
watch the
regardless of what their
whole
background may
interview.
be,
You're gonna love it. Greg
then,
is coming to the
I have to
cookout.
be
He's bringing
satisfied
a
with that,
potato
and the
salad.
rest I put in
And
God's
you
hands.
already know,
Yes,
child, he want me to
yes,
cook the
thank you,
gumbo,
Greg.
okay?
And I
So
also
y'all
want to
tune
ask you,
in.
and
Happy
especially in this
Thanksgiving
country where
2025.
healthcare has
I hope
become
that
such a
everything works out
main
for you and your
issue.
Hmm.
family.
And
It'll
I
be
love that you said,
amazing.
regardless of the
Bye
person's
bye.
background, where they
Yes.
come from, or whatever, a cancer doesn't have no favoritism.
Doesn't care.
Everybody.
Doesn't care.
So would you well, I know you would advise anybody, any nationality, no matter what your background, income status
Hmm.
is, to make sure that at least, would you say, once a year you're getting a checkup, no matter what?
It's a good question. There are some guidelines that they put out there in the medical community to talk about who is potentially at higher risk, for getting
Okay.
lung cancer. And like I
Okay.
said, and there is no stipulation in these guidelines for, well, if you look like this, or your income is this, or this is your job or whatnot. This is everybody. This is a human condition.
Right.
This is not a racial condition. This is not an ethnic condition. This is not a socioeconomic condition. This is a human condition. And so we're talking about human beings.
Mm-hmm.
And that's how I approach my practice. Is, again, we're treating human beings. We're not treating, somebody from this background or this background. No, we're treating human beings.